Welcome to Children's Hospital in Omaha, Nebraska. You have been referred to us by your primary care physician or pediatric cardiologist. We'd like to introduce you to Children's Hospital and the team of people who will be caring for your child. In this video, we will give you information to prepare you and your child for your child's upcoming cardiac surgery. We hope this information will make your stay easier and less stressful. During your visit, you will work closely with the cardiothoracic team, which consists of the surgeons, cardiologists, physician assistants, and pediatric nurse practitioners. You will also meet nurses from special care areas, such as cardiology, operating room, intensive care unit, and the pediatric cardiac floor. We have worked closely with your cardiologist and have discussed at our weekly conference with all members of the cardiac team the best procedure for your child. Your cardiologist or family doctor has provided us with the most important information regarding your child's condition so that we can meet his needs. The process usually starts by meeting your cardiac surgeon in the cardiothoracic clinic. At this time, the surgeon will explain your child's surgical procedure, including the reason for doing the surgery, the risks and benefits, what to expect during and after surgery, and also answer any questions you have. You will also meet other cardiothoracic team members during this visit. Your child will continue taking most medications, but some need to be stopped prior to surgery. It is important that you tell the surgeon what medications your child is currently taking. Please note that no aspirin or ibuprofen should be given for 1 week prior to surgery.
With the surgical consultation that happened, I guess it was about a week beforehand, we were scheduled for about an hour and a half with Dr. Hamill. And as we went through, we were extremely nervous going into it, but he really went through every step with us. In fact, it must have been right around an hour and a half into it, he got paged. He told a nurse to basically have someone else take care of it, and he sat there with us for about another hour until we felt 100% confident that things were going to be good.
Usually, the day before surgery, you will need to bring your child to Children's Hospital for pre-operative testing. Before you come in, your child should be screened for conditions that would require postponement of surgery, such as ear infection, thrush or yeast infection in the mouth, green or yellow nasal drainage, active cold symptoms such as runny or congested nose, cough, fever, cough and or wheezes that are not normal for your child, fever above 100.5, lice, ringworm, chickenpox or exposure to someone who has chickenpox, diaper rash or any unusual rash, worsening of a chronic illness. Some examples include asthma, epilepsy, feeding, abdominal problems, or kidney disease. Please call our office if your child is experiencing any of these problems. You will go directly to the CARES unit, which is located on the lobby level of Children's Hospital, and staff will register your child and take vital signs. During the preoperative testing visit, your child will meet with an anesthesiologist and a nurse practitioner or physician's assistant from cardiothoracic surgery. The entire process usually takes 2 to 3 hours, so please feel free to bring items that may keep you and your child from getting bored, such as a favorite toy, blanket, books, magazines, or a favorite video. You might also want to bring your child's bottle as well. Testing includes a chest x-ray, an EKG, blood draw, and a physical examination. You will also be asked to give your child's medical history. When you meet with the cardiac anesthesiologist, he or she will review the process of what happens before surgery while your child is first given the medicine to go to sleep, as well as during and immediately following surgery. Before you leave, you will be given instructions about when to arrive for surgery, what time your child should stop eating or drinking, and when to stop medications before surgery. When you arrive at Children's Hospital on the day of your child's surgery, you will go directly to the CARES unit to check in. You will be able to stay with your child in CARES until she goes to the operating room. Your child can bring an item of comfort to take with her to surgery. This can be a favorite toy, blanket, or pillow. If necessary, your child's anesthesiologist may order medication to help relax your child. Your child will be cared for by team members who are especially trained in pediatric cardiac surgery. In addition to the doctors, team members include nurses, perfusionists, specialists who operate the heart-lung machine, and surgical assistants. Shortly after arriving in the operating room, your child will be given sedative and anesthetic. The anesthesiologist will give these medicines in such a way that your child will gently go to sleep. When your child is fully asleep or under deep general anesthesia, the surgery team will place special IVs and monitoring equipment that will be used throughout your child's surgery. A breathing tube, called an endotracheal tube, will be inserted into the trachea or windpipe so that breathing can be controlled with a breathing machine called a ventilator, during as well as after surgery. When the cardiac team feels that your child is able to breathe adequately without the ventilator, then the breathing tube will be removed. Your child's age, the type of surgical procedure, and your child's condition after surgery will determine how long the breathing tube will be left in place. For most cardiac surgical procedures, the cardiopulmonary bypass machine, also known as a heart-lung machine, is used to do the work of your child's heart and lungs during surgery. Your surgeon will explain this to you in more detail during your visit before surgery. Depending on the type of surgery that is done, the time that your child will be in the operating room varies from 2 to 6 hours.
Our child's surgeon was Dr. Duncan, and did an awesome job from start to finish. Before the surgery even took place, he spoke to us and told us the step-by-step procedures. The staff here was very helpful, very friendly. They supplied everything we needed to transition through this surgery that Seth underwent. Another nice thing, as soon as the surgery was over, the doctor was in the room with us, to the point where you could still see he was wearing his surgical mask, the imprint on his face. So he could not have been out more than 2 or 3 minutes and came right to us and told us exactly how the procedure went. And a very detailed surgical procedure.
They explained everything very well, and again, the nurses and the surgeon all are just very precise, and they say, okay, this is where we're headed, this is what we can expect, and if anything, they would call from the OR room and say, okay, this is where we are, everything's going great, we're actually in a better position than we thought, or whatever, and through the entire time, they either came into the waiting room or they called us on the phone and let us know exactly where they were so that we were never kept out of the loop.
We will show you where to wait during surgery. This special family waiting room for cardiac surgery patients is located on the first floor behind the Access Center. During the surgical procedure, an operating room nurse will give you frequent updates on the progress of the surgery. At this time, you will be given a card known as a PROX card that will give you access to the patient floor on which your child will be staying. This is a safety measure to ensure the security of your child during his stay at Children's Hospital. Following surgery, your child will be taken from the operating room directly to the Pediatric Intensive Care Unit located on the second floor of the hospital. This floor is also referred to as the PICU. Immediately following surgery, your child's surgeon will visit with you about the surgery in the family waiting room. Approximately 30 minutes after your meeting with the surgeon, you will be able to be with your child in PICU. Your child will be in a private room where he will be cared for by the PICU and cardiac team. You will meet physicians called pediatric intensivists who have special training in the care of critically ill children. At Children's Hospital, intensivists are in the hospital 24 hours a day, 7 days a week to care for your child. The PICU nurses also have received special training in the care of pediatric cardiac surgical patients after surgery. Other PICU team members include pediatric nurse practitioners, respiratory therapists, residents, child care partners, and receptionists. Cardiologists and surgeons, as well as other members of the cardiac team, will be making rounds and checking on the progress of your child after surgery. After surgery, your child will have several lines and tubes in place. Besides the breathing tube, there will be special central venous lines, a tube that drains the stomach, chest drains, temporary pacemaker wires, and a catheter into your child's bladder. As your child recovers, each of these will be removed. The length of time your child stays in the PICU will vary depending on the type of surgery done. You may stay with your child in the PICU 24 hours a day. For your convenience, each room is equipped with a single built-in bed. It is up to you to decide who may or may not visit your child in the PICU. Up to 4 people may visit at a time, as long as they are all free of infections. Brother and sister visitation is allowed, so please talk to your nurse for more information about this. PICU also has a family waiting area for your use. Larger groups of visitors may gather here to watch TV, play games, or share quiet time.
Well, as coming into the medical environment without, having any previous knowledge of Children's Hospital, it felt like, you're coming into a foreign country. And so the communication between all the doctors, all the nurses, was outstanding. We really took extra efforts to make sure that we communicate both with the nurses as well as the doctors to make sure that we were up to speed on all the different procedures, throughout Ian's care.
And to make sure we're on the same page. Did you understand that? And if not, then we can re-ask the question again. And everybody was so patient with us, and there was no problem. You felt very comfortable because you're basically handing your child over to them, and they're in their care. And we were blessed that when they did rounds on Ian, we were able to partake in that. And if we didn't understand something after the rounds, the PICU nurses and staff were wonderful re-explaining it, and it made us feel like we were a part of the decision-making process. Gave us a little control that we felt we didn't have.
Throughout your child's hospitalization, the cardiothoracic team will be involved in the care of your child in collaboration with the pediatric intensivists and pediatric cardiologists. Throughout your child's stay in the hospital, we also communicate with your pediatrician, family doctor, and cardiologist near your home so that they are informed of the progress of your child's recovery after surgery. Every morning, the cardiac team makes rounds in the PICU. At these rounds, every aspect of your child's condition is discussed by the many members of the cardiac team. You are welcome to join the team when rounds are made on your child. When your child is well enough to move out of the intensive care unit, he will be transferred to the 5th floor. This is a pediatric unit that specializes in caring for cardiac patients. The 5 med-surg team includes nurses, child care partners, and residents who will all care for your child. The cardiac team will continue to make rounds at least once daily. This is the time that your child will require less nursing care, and you will be able to provide more care and comfort to your child. Each room has a single built-in bed, bathroom, shower, vanity, computer desk, telephone, TV with VCR DVD, and a refrigerator for your use. The entire hospital is equipped with wireless technology, so feel free to bring your laptop computer. It is our goal for the whole family to be as involved and comfortable as possible during this time of your child's recovery, and as you transition to take care of your child's needs at home. The care your child needs at this time is less intense. Your child may be connected to a monitor for a short time. Depending on your child's needs, we may need to monitor the oxygen saturation in the blood, heart rate rhythm, or breathing rate. During this time, the focus changes to resuming routine daily activities, nutrition, and generalized recovery. We will encourage your child to be active as this helps in the recovery process. There is a playroom on the 5th floor for patients which is staffed by child life specialists. When your child is nearing the end of his hospital stay, a cardiology nurse will review discharge instructions with you and your child. You will be given a booklet with all of the instructions on feeding, bathing, and wound care, as well as restrictions and medications. Your child will probably go home with prescriptions for 1 or more medications. The medications or doses your child needs when he goes home may be different from what he was taking before surgery. we will make sure you feel comfortable with all of the discharge instructions before your child is dismissed. The cardiologist will call as well as write a letter to your pediatrician or family doctor to make sure they are all informed of your child's condition and plans after discharge.
Yeah, the nurses were able to, I mean, I know they have other patients there, but honestly, they were, in caring for her so much, and really, it seemed like they took, a lot of personal care of Hannah, which was it was very comforting to us. I know I would walk the halls with Hannah, and I know there's other rooms of people, and I know they were taking care of them as well, but to us, it just kind of seemed like we were the ones they were taking care of.
There's a lot of bells and whistles and noises and things that go on, and the first couple times you hear all those, you really it startles you a lot, but it definitely helped to know exactly where she should be and that everything was okay. I mean, they knew everything about her, so that was great.
Most children can return to school in 1 to 2 weeks, but will be restricted from contact sports or extreme physical activity for 1 to 3 months. After open heart surgery, immunizations should not be given for at least 6 weeks, and 6 months for the MMR and varicella vaccines. Prior to dismissal, you will be scheduled for several follow-up clinic appointments. These include a clinic visit usually within a week at your doctor's clinic near your home. We will also schedule appointments in cardiology clinic and cardiothoracic surgery clinic. If you have any questions between appointments, please don't hesitate to call your surgeon or cardiologist on call. Children's Hospital not only cares about the well-being of your child, we also care about you, the parents. The Carolyn Scott Rainbow House is available to you and your family for a place to stay while your child is recovering from her cardiac surgery. The Rainbow House has individual hotel-like rooms and is located just a few blocks from the hospital. You will be given additional information about the Rainbow House if you are not from the Omaha area. Throughout your stay, other support staff will be available to care for you and your child, including child life specialists, social workers, case managers, lactation specialists, physical and occupational therapists, chaplains, dietitians, pharmacists, and others. Please let your nurse know if you would like to visit with any of these team members. Children's Hospital also has a chapel that families are invited to use for prayer, meditation, or quiet time. This is located on the lobby level across from the ATM machine. We hope this video has helped answer some questions you may have had and will help prepare you for your child's surgery. We look forward to caring for you and your child.